Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hi there, Wellness Wednesday listeners. I am back in the studio. Always lovely to be back in here because it's such a cool thing that we do. But I'm here with a pretty special guest. All of our guests are pretty special. But this guest likes to introduce himself as Dr. Heid, but also that he doesn't have a uterus, which I really much appreciate that he knows he doesn't have a uterus. So welcome to our studio, Dr. Heid.
Thank you, Helen. It's good to be here.
Thank you. Thank you. And you traveled to get here today, right?
Yes.
Yes.
From Vancouver, Washington.
Yes. And that was a good ride?
Yes. Yeah. I got some work done. It's always better when someone else is doing the driving.
As I expressed when you came through the door, I am such a snob and I do not do public transportation. So kudos to you for taking advantage of all these things that I'm supposed to be doing as a Seattleite, which I don't do. So there you go. Dr. Jim is here. Would you like me to refer to you as Dr. Jim or Dr. Heid?
Dr. Jim.
Dr. Jim. Okay.
Sure.
Dr. Jim, can you tell us a little bit about yourself, how you got into medicine, and
Sure.
And what is it about medicine that gets you going?
Sure. So I come from a family of engineers and thought I would be an engineer. And A few things happened in high school. I would say mostly biology and physics. And biology, I struggled, but I loved it and I got a B. And physics, I did not work at all. And I got an A. And it was like, no, I can't do this. And I swam and became a lifeguard. So I took a bunch of first aid type classes. I was like, yeah, maybe I'll be a doctor, sure. And then I decided, why not shoot for the stars and be a neurosurgeon? So that was my goal in high school and then college and then getting into med school. And then I didn't know what I wanted to do. And it just happened that I fell into family medicine and I ended up delivering our second child at home completely unplanned.
Whoa.
I still am angry with my wife for that whole thing.
What?
I think I'm having contractions. I think I pushed. Can you take a look? Yeah.
Okay.
45 minutes of sheer terror and then a baby slipped out. Yeah.
Oh my gosh. Like in your living room?
No, in bed. The same. He was born where he was formed. Yes.
Whoa.
Yeah. So
45 minutes? That's not that bad.
Oh, it was horrific trying to figure out what exactly was happening. But,
okay.
Yeah.
Wow.
So that pretty much sealed the deal that I was going to be doing women's health. And and then I started working, went to family medicine residency, did lots of women's health electives, and I worked in California for a while and then life blew up and it was like, okay, something different, maybe not women's health. And like, no, I called to Washington State to work with a group and do women's health and OB. And I don't know, I lost track, but probably delivered around 1,000 babies.
That is so cool.
Yeah.
Including your own.
He was, I think that was my number. I think that was number 30 because I did 29 in med school on my rotation because I was just like, I'm going to take this seriously. In fact, not the dean, but the OB doc that was overseeing the rotation when I had my exit interview, he's like, you did 29 deliveries? That's got to be a record. I'm like, if I was going to be here, I was going to get some experience out of it.
So what was the problem delivering your own kid? Was it just, it's just a whole nother weird thing?
It happened super fast. My wife.
Good for marriage.
Yeah. My wife would not let me check her, so I didn't know what was going on. I just had to go based on her, I think I pushed. I think I feel something. Can you look down there? And don't put your hand in, just look. And I'm like, well, the first time I looked, I'm like, yeah, it's a vagina. Yeah. The second time I looked, I was like, yes, there's
Okay.
about an inch of head showing, yes, you're about to have a baby. And at that moment,
Whoa.
she said her husband left the room and Dr. Jim showed up.
Okay.
And I was a very different person from that moment. Once I saw the head, it was like it was business, and I instructed her what to do, and I'm trying to remember APGARs, and I'm looking for my stethoscope. So, it was harrowing, I think, for both of us in very different ways.
Sure.
She's, oh my gosh, I'm going through labor, and I'm thinking I've got the world's most important patients here that I gotta do a good job.
Oh, gosh. I'm just thinking now of like cleanup.
Oh, yeah.
That was probably.
I grabbed a couple of old towels and had the thought to throw those down.
Yes.
I had an older brother who had lost a mattress to his wife's water breaking in bed. So we had a plastic cover over the mattress under the sheets.
Okay.
And then as we went to the hospital because I couldn't get hold of the doctor, I ended up calling 911.
Okay.
We ended up getting swished off to the hospital because the baby's blue and her blood pressure's low, both of which were totally normal, but 911 didn't know that. And our neighbors who woke up to the commotion of the ambulance arriving stayed up at midnight, washed our sheets, threw out the towels. They said those were gone, and they washed everything else. And so we came home. I came home to a clean bed.
Wow. That's really cool.
Yeah.
Yeah.
It was, and of course, that's the talk of the apartment complex. Like,
it was in an apartment too.
Yes. Yeah. The kind of like, well, you deal with what you get. We had called our upstairs neighbors.
Yeah.
They were like, hey, we'll come and stay with Steven. So I called them and said, she's having contractions, and can one of you come down? Of course, the husband came down, and my wife's in a bra on the bed, and she's calling for me, and I'm like, I could use some help. She's, I don't care who comes in.
Oh, yeah, at that point.
So our upstairs neighbor got a view of my wife that he never expected, and hey, thank you for your assistance. He's whatever.
I know. At this point, it's like, let me leave with your child, please.
Again. I think he just crashed on our because this was middle of the night, so he just crashed on our couch or whatever after he finished helping our other neighbor with the laundry.
Oh, okay.
Yeah.
Well, you guys are very on trend. I don't know how long this was ago, but
30 plus years ago.
Yeah, see, everybody's having kids at home these days. It's like the hip thing to do.
Our doc was out of town. The group of docs that was covering, I think I saw 2 or 3 of them. The 15 hours we spent in the hospital. And they all came in, Jim, you got to be a family doc. You've got to do OB. And I'm like, yeah. All right. Yeah. So,
well, that event, which sounded very exciting and good for Mary, 45 minutes. That's really good. So sparked your interest in women's health.
Yeah.
And did you ever thought this was the direction you were going to go, like women's health specifically?
Yeah. It's funny because yes, in some weird way. And yet it was like I said, it was always something I kind of held loosely. So in 99, when I had a couple of bike accidents and my life got reoriented, I worked a few jobs doing all sorts of different stuff. I did some home visits and urgent care. And then I got a mailer saying, hey, come to the Great Northwest. And after a few interviews, we came up here, and I joined a group that needed docs that were doing OB, and and then I was hooked, and I was seriously looking for something around 2020, 2021, getting of the age where I don't want to be up all the time, because for the last 11 years, I was doing all my own deliveries. So I decided I'll go into palliative care. Really huge need for that. Started planning all that route out, and then was asked by the women that were running Options 360, when was I going to come work for them? I'm like, you said, wouldn't it be great? Now all of a sudden you're asking when, let's talk.
Yeah.
And evidently women's health was still in my futures.
Okay.
Yeah.
See, I don't see you started saying that your family's background is engineering, and then you went this different route. And I was like, now that I'm connecting the dots, that's not too far off, because I feel like a women's reproductive system or women's health is very intricate and it's very unique and it's very engineers like to tinker with things.
Sure. And
So
engineers would love to look at all those charts, like the hormones and the spikes and the peaks but they'd probably nerd out on the slope. And is this a asymptotic versus Bell versus what type of curve is this?
See? So I feel like that's still very connecting to your engineering roots.
Well, and some of the things we'll talk about later is these devices now that are helping women track their cycles, and especially one shows promise for those who are lactating, which is a really difficult time to track your cycle. Yeah, so there are some engineers helping women live chemical-free and yet still track their fertility, their cycle, or lack thereof, and know when, kind of predict ovulation. Yeah.
Let's dive into that.
Let's dive in.
Specifically, you wanted to talk about the luteal phase, the follicular phase.
Follicular phase and the luteal phase.
Okay. Tell us more about that. Why are you passionate about this?
Women should know what's going on in their body.
Amen.
Men should know.
Yes.
Back in the day when we got married, we didn't have phones. We didn't have apps. We took I think it was called the symptothermal method. There's lots of methods out there.
Yes, lots of methods.
But I loved the philosophy of the symptothermal because they were like, okay, so this binder, this little book with the graph paper, it doesn't go on her nightstand. No, it goes on his nightstand.
Yep.
Why? Because then at the end of the day, you have a conversation and you both play a role in deciding, is it safe or is it the right time to be intimate or is it not, as opposed to just the guy saying, hey, what's going on? Can we or can we not, huh? Not that guys would be like that ever.
Oh, no, never.
Yeah. So the follicular phase, that's the very beginning, and that starts when your period starts. So first day of your period is the beginning of a new cycle. It triggers the end of the last cycle and a new cycle starts. And during that, your ovary is forming little follicles. That's why it's called the follicular phase.
Yeah.
And I think of it as a race. So there's a bunch of little follicles on both sides, all trying to get to a key point of development. And then once one follicle gets that key point, it sends out chemicals to say, hey, I won the race. All y'all stop and
Chill
go
out.
away.
Yeah.
And they shrivel up. And that one follicle then matures to the point where it releases the egg.
Yeah.
And that's all. So somehow the ovary sends chemicals to the brain sends chemicals, lots of fancy names, FSH and estrogen and progesterone, but they all create a cascade of peak hormones that occur right in about the middle of the cycle, triggers the release of the egg, and then you start luteinizing hormone and progesterone, and that gets you into the luteal phase. Now, during the later half of the follicular phase, so that second week, your things happen in the cervix. So there's fertile mucus, there's all different types of cervical mucus. And some of this stuff I've known in kind of the 10,000 foot level, but it's been fun just for this podcast to do some reading and updating. I did not know that the cervix is, it makes sense, but it's an inch, or they say 25 millimeters. And for us Americans, that's an inch. For any Canadians or anywhere else in the world, they know what a millimeter is.
Yeah.
But the cervix is not just this little tube. I'm probably showing my age to say a Thomas's English muffin. because their advertisement was they're full of nooks and crannies. Well,
yes.
is the cervix. And those nooks and crannies are glands that make mucus.
Oh.
And
I could totally picture it.
yeah. So that mucus, so there's different types of mucus. In fact, the earliest part of your cycle, the mucus is very similar to something that everyone's heard of, who's been pregnant. The mucus plug, because everyone wants to know what it means when they lose the mucus plug.
Yeah.
All it means is the mucus plug came out.
Yeah.
It does not mean you're going to go in. It means you're going to go into labor within the next month.
Yeah.
But at that point in the pregnancy, you better be going into labor in the next month anyway.
Anyways.
So
yeah.
people get really excited about losing their mucus plug, and it's not a big deal. Sorry, sidetrack. But so there's the G mucus, which is that really thick
paste.
Yeah. It's full of cells, and it's a barrier, and we think it's part of the immune system. It keeps infections out.
Yeah. I always describe our system down there as a self-cleaning oven. Don't mess with her. She knows what she's doing.
Yes, and you should never, ever douche.
Yes. Don't put anything up her that is like not naturally supposed to be there. How about that? Stop putting soap and smelly things and crystals and oils. Just leave her alone. She's a self-cleaning oven. She got it.
She got it. Yes. So then as you're entering that fertile phase, which is it's the last 5 to 7 days-ish of the follicular phase, the L mucus starts breaking down the G mucus. And it's really interesting. It's sticky, and somehow it knows what bad sperm are, and it's, come here. You're trapped. You can't. So the low-quality sperm gets stuck in this mucus, and then a few days later, the S mucus comes, and it's like, hey, high-quality sperm, come over here. So it attracts, and that's why we know that the egg is viable for 12 to 24 hours, but the sperm can live in the cervix for, we think, up to 5 days. So that's where it gets tricky is...
Yeah, I literally say they set up camp. It's like... Those suckers are like, we're here to hang out for a while.
And then the S mucus is followed by the P mucus, which is the stuff that they say is egg white. I remember when we took our class, they're like, yeah, if you want to see how far you can get your thumb and finger apart before it snaps. And I'm just like, let's see, I was in med school at the time, and I'm just like, this all sounds a little gross. But
we call it lady gel.
Lady gel.
I was being taught what it was.
Yes, absolutely. So that is that's the first half of the menstrual cycle.
Okay.
There are apps that track all this stuff. There are apps that just go based on symptoms. There's low tech, go off symptoms, cervical mucus, breast changes, period tracking, which takes some time, including history to figure things out. Some use basal body temperature, some do not. The higher tech apps, I'm assuming everyone knows apps are on your phone, and everything's on our phone now.
Yes.
So getting into the higher tech, there are urine sticks or pee sticks for estradiol, LH, even into other hormones, PDG and FSH. So if you're looking at these devices, there's a Permom, Prove, Uva, Inido, and Mira. These are monitors that you pee on a stick and you stick the stick into, and it checks all these amazing things. It's just amazing, the technology, but there's still room for improvement. But like I said, the Mira, M-I-R-A, is the one that shows promise to help lactating women figure out what's going on, because the problem is if you've got a young baby at home, most women want to prevent another pregnancy.
Yes.
You will ovulate before you have a period most of the time. So you can't just wait for that period to come. You're looking for signs of ovulation when your mucus is whacked out, and everything is, because the hormones that keep the milk supply going do change your ovulation cycle, but it doesn't really tell you when, hey, I've turned it back on you.
Exactly.
So we're looking for ways to give women clues.
Yeah. My friend who was relying on breastfeeding to space out her kids, she literally had her baby on her and would make him feed every 2 hours. And that, she said, that was her way of making sure that
for up to 6 if you are exclusively breastfeeding, and I don't know if there's 2 to 3 hours is the rule I've heard of, and at least once during the night, you've got definitely 3, probably up to 6 months. But still, when you've got a 6-month-old, are you ready for a pregnancy? I don't know if I've told you this story, but I remember I started my OB rotation with a 2-month-old at home.
No. Wow.
And I was amazed at the difference between a newborn and a 2-month-old that I had at home. And I looked at my wife and I was like, oh, those newborns are so cute. Something like, I can't wait to do this again or something like that. And I was luckily able to sleep in the bed after that statement, but I was on my side, don't touch
me.
Don't even, no, that statement was not appreciated. I don't care how cute you think newborns are. Not cute to me right now. So we have 3. We only have 3.
Yeah.
So that gets us to bang, you ovulate. Now you enter the luteal phase. The dominant follicle releases an egg and becomes what's called the corpus luteum, which is Latin for white body. And that produces progesterone to a point. And again, we don't even understand all of the chemical signaling that goes in the body. But somehow if that egg gets fertilized, it sends a signal back to that corpus luteum and says, keep making progesterone, because it's got to make progesterone for at least 12 weeks till the placenta is formed, and the placenta then makes the progesterone that keeps you pregnant. If you don't get pregnant, if that egg doesn't get fertilized, it doesn't send a signal, and that corpus luteum makes progesterone for roughly 14 days. Somewhere between 12 and 16. So women who have a shorter or longer cycle, what we do know is that the follicular phase can be really varied. The luteal phase from ovulation to the start of your period is, I'm surprised, I was always taught 12 to 16, but now they're saying 10 to 17 days. So it's fairly fixed.
Yeah.
But if a woman only has a period every 2 months, she has a really long follicular phase, but still that luteal phase is only just 2 weeks, maybe a little more. And some people are like, the luteal phase is the important phase. That's when you ovulate, but that egg is only around it's only viable for 12 to 24 hours.
Yeah.
Again, it was that 5 days before where that's where the real action or risk or excitement, depending on whether you're avoiding or trying to get pregnant is.
Yeah.
Yeah. And it's so funny. I had not heard this until recently, but even the American Association of Pediatrics and ACOG, American College of OBGYN, 2006, they were pushing for the menstrual cycle to be considered the 5th vital sign.
Yeah.
And it is funny because it is, if you look at an electronic medical record, it is under vital signs. That's where you enter the last menstrual period.
Yeah.
So, yeah. And the other thing that I thought was fascinating is millions of people around the world are using ovulation tracking apps. I myself was using 2 for a period of time because you cannot track 2 cycles on one app.
Yes.
So I had one for my wife and one for my daughter.
Look at you.
I wanted to keep track.
For when you need to buy them chocolates, when to give them a hug,
when to not chastise my daughter. I think it was a Saturday morning. She came upstairs and I'm like, you were very disrespectful to your mom last night. And she starts crying. I know. Okay. Are you on your period? And then she starts crying and laughing. And she says, yes. And I said, you're in trouble. We will talk in a week. And I left the room.
You're a brave man to ask, are you on your period? Because that's usually a, what do you mean? kind of response.
My daughter, I'm sure that she occasionally chatted with her mom about female health. Rarely. She always came to me with questions about discharge, periods, this, that, the other.
That is so cool. That is really neat.
And as a dad, I, of course, gave her the answers because I had the knowledge. But then I also would say things like, so how many of your friends are chatting with their dads about this? And she would just, you're a doctor. Deal with it.
Yeah.
I don't mind.
I think that's super cool.
Oh, yeah. But
that's a gift.
You still got to give her grief about it.
Oh, yeah. But
and that's
what dads do. But that's an advantage that she had over her peers.
Yes.
So, okay. So you were tracking just for your own sanity.
Basically, yeah.
Okay. Would you recommend that to other husbands?
I think husbands should be involved just in general. It's not for self-preservation, but out of this is a part of our relationship.
Yeah.
A part that you are much more immersed in. But like you say, I know I don't have a uterus, but I have a role to play.
Yes, you do.
And when patients ask me about what's going on, the fact that I can say, hey, I don't have experiential knowledge. Mm-hmm. I have a lot of reading and walking women through this knowledge. This is where I'm coming from. I don't know what it feels like, but I can tell you this is what happens. I've talked with enough women about the letdown. I can almost imagine what I think it would feel like. But that's because I've just talked, and my wife and I watched her and it was very instrumental with my patients. I could say, okay, you're having trouble with letdown. How's your stress level? What do you mean? When my wife would get uptight, she would hand me the baby. She would walk away for 5 minutes and calm down because nothing was coming out.
Yeah.
Zero.
Yeah. Yeah.
She would come back calm.
Yeah.
Sit down, and the floodgates would open and milk.
Yeah. Yes.
And that was so helpful to be able to tell my patients stress plays a big role.
Yeah. Yeah.
And I know the Hispanic culture has this belief that stress makes bad milk. No, stress just makes it hard for the milk to come out. And so if you can partner together I always told my parents, my patients who are parents, when you have a baby, you're going to sometimes, even for a second, want to do something bad. That's why you're given cribs and you put the baby in the crib and you put yourself in timeout till you calm down.
Yes.
That's true for moms and dads.
Oh, yeah.
We're human. And those little buggers are sometimes.
My husband always says, God made babies cute for a reason, or else we would just leave them in the forest. We would just be like, I can't deal with you right now. We're just going to leave you here for a little bit.
Yeah.
And speaking from the perspective of adoptive parents, I didn't give birth to my son, but man, all those, I need to probably do some research about adoptive parents and how your hormones change when you bring a newborn into the mix of things. I'm sure things get all changed and it affects your hormones. I'm sure of it because
I would imagine it does. And the one thing I haven't seen any studies on is everyone talks about women's cycle getting in sync. Mm-hmm. How does that happen?
Yes.
I think we know that other animals have pheromones and we say humans don't. There's got to be something that is transmitting from body to body through space.
Oh, yes.
Which the only thing that I can think of that we know scientifically does that is pheromones, but women do get on sync. So there's got to be some. So yeah, sure, having a baby in the room when you're in a group and a baby cries, it's not the women, it's the moms in the crowd all do the same thing. They're bouncing up and down and shaking side to side, and they're all doing it whether they have a baby in their arms or not, because that's the motion that calms a baby.
Right.
And when a baby's crying next to you, you just do it instinctively.
Yeah. Or like you reach out and literally is, let me take it.
Yeah.
Let me help.
Right.
Yeah. Just working in a women's clinic primarily with other women, like our periods all sync. And the running joke is, okay, I guess this week we're just going to wreak havoc on the plumbing. But it's not like we called each other and synced it all up. It just naturally happens.
Yes.
Yeah.
So speaking of moods and, times where things aren't as good, one of the other things related to menstrual cycle is PMS, PMDD. What is this thing and what can be done about it? PMS is premenstrual syndrome. PMDD is premenstrual dysphoric disorder. And as best as I could understand it, it's like one's just a degree higher. Some women have nothing. Some women have PMS. Core features of PMS are that occur during the end of that luteal phase, so like the last week before your period starts. And in order to make the diagnosis, you have to have those several cycles, and they're in that last week, and they're relieved by the start of your period. Occurs during the first 5 days before your period starts, and is present for at least 3 consecutive cycles, what ACOG says.
Okay.
And it said there's 150 physical, behavioral, and emotional and cognitive symptoms. I didn't want to look or write down all of those up. But most common mood-based symptom is mood swings, and the most common physical symptom is bloating, abdominal bloating, or a sense of fatigue.
Yes, all of the above.
Yeah. And basically, your symptoms get more severe than that is associated with reductions in health-related quality of life. So if you have 1 to 4 of the symptoms, it's PMS. If you have 5 or more symptoms, and one of them is mood swings, anger, irritability, a sense of hopelessness or tension, then you have PMDD, which is that more severe form. And that is one that women should seek help for, because there is treatment.
So PMS, I've heard from a variety of friends who I will not name, but some of them have told me PMS is just in your head. You can control these mood swings and you can control your irritability. What would you say to those ladies because I have PMS, that is a real thing for me. I catch myself now that I'm older, and I want to say more in tune with my emotional intelligence, that I'm like, oh crap, that last week didn't piss me off. This week is sending me up the wall.
Sure.
So can I just control those?
I think the mind is incredibly powerful and malleable. Even the same thing with like depression. Do you need medicine? Do you do therapy and stuff? I always said there's a threshold at which you cross over and you're not in a healthy spot.
Right.
So counseling helps you lower that. Actually, really, it's more the cognitive behavioral therapy, teaching your brain new neural pathways that are more constructive. That lowers the threshold. Now, it takes work to do that.
Yes.
So if you are living where 1 week out of the month, you're over that threshold in a bad way, medicines can help to prevent you from going over the threshold while you work on the cognitive behavioral therapy. So I think it's a both and, not a either or.
Okay.
Hopefully you're not just doomed to have those horrible days and you're not stuck on meds forever.
What are some of the meds that would help? Kind of curve that, or
boy, these are one of those things where it's
kind of trial and error.
It is, and it's really, this is where, okay, is depression all in your head? No, but basically it is a neurologic phenomenon. Does that mean you're just making it up? There's a difference between there's a physiological process occurring in your brain that brings out certain symptoms versus you're just making this up.
Yeah.
One is a physiological neurochemical thing that's happening in your brain that you're not bringing on willfully. The other is, you're just making this up and using it as an excuse so that you don't have to deal with us. But yeah, so a lot of the medicines used for PMDD are the antidepressant medicines because they are effective in that mood realm. And then your sometimes diuretics, just mild diuretics, something to help you pee off a little more water so that you don't feel as bloated.
Why does bloating happen?
Because
during that time,
if your blood vessels dilate and there's more blood flow in that area, as the blood vessels dilate, they also become a little more leaky. So the liquid that's supposed to stay in the blood vessels gets into the tissue and the tissue just gets bigger. Yeah, so you are bloated.
Cool.
Yeah.
Okay, that makes me feel better. Because I'm always just, damn it, what the hell did I eat this week then?
That's usually what it is for me.
Yes, but you don't have a uterus.
I don't.
Yeah, but I'm always just like, why do I feel like a planet this week? That's literally how I feel.
Well, like Mars or Venus or?
I don't know. Whatever ginormous planet is out there right now. I'm not good with planets, but I think PMS is so real. It's very real. It's very present.
Yeah. And again, any disease state is going to be worsened by stress.
Yeah.
And because stress, we get cortisol and adrenaline, and those are great if you need to run away from a lion. They're great in like bursts, but if you've always got it, it just doesn't do good things. Addressing the stress, even past stresses, even our brain can learn to be in a fight, flight, response mode, even in non-stressful situations. Sometimes that's addressing those will lessen your PMS, not saying that's the cause, but it makes it worse. If we have time, I would like to go on to this follicular phase.
Oh, yes.
So this was a typo.
Tell our listeners why we're talking about this.
So, but it was a third thing. It was like, talk about the follicular phase, the luteal phase, PMDD, and the follicular phase, FACE. And I was like, is that what you really meant? And then I get this response, and I had already started Googling it. So I get this response saying, no, follicular phase. And so I went on to the internet and National Public Health, there are studies that look at, they looked at what they called incoming and outgoing changes in a woman. And they found, so they looked at facial shape, like symmetry, averageness, whatever that is, and sexual dimorphism. And they didn't see any change in those over the follicular cycle. However, they did notice, and one of the articles they had computers and they examined basically the high cheek area. Okay. And computers could detect different levels of redness, of color. And they were like, but the human eye can't. The computer can recognize this, but the human eye can't. Then they showed men. Evidently, they took pictures of a bunch of women. Okay. But they also took pictures like noting which day of her cycle she was on. Yeah. And evidently, they flashed a bunch of pictures so that each woman got flashed to the men several times. During her fertile phase, the same woman was rated as more attractive. So we noticed just this fuller, little pinker, little.
Oh yeah, that's when we want to go out. That's when we want to be wined and dined and feeling good about ourselves. And
right, and it's funny because people started looking at this. We're like humans are defective because other animals have visible swelling in that area. It kind of advertises, hey, I'm fertile. Yes. And we don't. But body odor, voice, facial appearance, all do have, and they didn't say what, but they just said body odor. They didn't get into all the details, but men rated women in that fertile phase, their body odor was more attractive. I've never thought of body odor as being attractive. Their voice was more attractive, so
Yeah.
softer,
Yeah.
fuller or something.
Yeah.
And their facial appearance, yeah. Now, the outgoing cues for women was that women are more attracted to masculine men when they're fertile. They flirt more with attractive men when they're fertile. They will put more effort into makeup and choosing clothing. And one of them said being more stylish, but also more red clothing. Yeah.
Okay.
So there
Warmer
is
tones.
Yeah. So the human animal is not defective. The human animal, the female of the species, does advertise in some subtle ways. Maybe we could just say that we're higher functioning, so the cues are more subtle.
Subtle.
And that's, of course, that could scare a guy away if he's not ready to be a dad, or it could.
I don't think they think about it until like
After.
Yeah. They're like, oh, crap.
No one is ever ready to be a parent.
No.
I always tell people that. They're like, we're going to wait till we're ready. So, you're still going to never have kids.
Yeah.
What? You're never going to be. Even when you think you're ready, children rock your world in incredible.
Yes. Incredible ways.
Yes.
Difficult ways.
Good and bad. The other thing that I didn't bring up is we know that being pregnant, like for women who struggle to get pregnant or have somewhat irregular cycles, not always, but sometimes being pregnant that first time makes your cycles more regular and actually improves your fertility.
Yeah, I've heard that.
Yeah, so it is an amazing cycle of life, and women should know, regardless of what they want to do with it, they should be more aware of what their body is doing.
Yes.
And guys, I hate to say we're simple. It sounds bad. We are biologically less complex, but intellectually we're there.
At a certain age, can I say that? I've been saying a lot of act your age, not your shoe size to a lot of the men in my life. But yeah, just women, like just you going, that's just our menstruation. That's not even other things that we have in tuned with or superpowers. I call them like our fifth vital sign is our period, but it's telling us all the time something. And it's so good to get to know it and not be like suppress it.
There is, and maybe this is just me, but my wife will say something. She'll say two things, and I'm supposed to know that they are not related. That the second thing was about something we talked about 3 days ago. And somehow y'all do it. Like, how did you know that second thing was what we were talking about 3 hours ago and not to what she just said? You all are in sync on that. And us guys are like, I don't know.
And just going back on our periods and why we have it and why it's somewhat should be embraced instead of suppressed. Like I grew up thinking that it was the worst thing in the world to have a period. And it wasn't until like my journey with infertility and learning more about my body and doing this kind of work that it's like, we really need to change the narrative on how we look at our cycles. It should be talked about in a much more positive light. I mean, I'm sure you've heard it's been referred to as.
You don't think the curse is a good.
Here she comes, knocking on our door again. It's like the worst thing possible. And it's actually really cool.
So I grew up, big family, 4 sisters. I knew that it happened, and it was.
Yeah.
I don't remember it being a traumatic event. Mm-hmm. So yeah, I don't think it was treated as a horrible thing in my family of origin, but yeah, it is a cycle that continues, and it shows without it, we wouldn't propagate as a species.
Yeah.
It's very necessary, and it's very necessary for both of us to be involved because you need the cells of a man and a woman to propagate the species. So yeah, and we need to spend more time appreciating each other for our differences
Yes.
rather than being I'm better or worse or
Yeah.
we were designed to be different and complementary, and hopefully we can do that. And in many ways, I am the visual spatial person and my wife is the memory person.
Okay.
She can remember where things are from 3 weeks ago.
Yes.
And she can't fit things in the car, and she just comes in and says, just go do your magic. And that's okay.
It's good. It's good
Yes.
that we're not good at everything. It's probably for our own egos that we're not good at.
Yeah, something like that.
Yeah. In your male professional opinion, it is important for men to know about these things as well.
Yes.
It's not just women, you should know about this, obviously, but it is important for men to know about
Sure.
this.
I think that we are all benefited by knowing what's going on. And
I think it's the loving thing to do.
sure.
I think it's a selfless thing to do. I know it's not like, yes, men, you'll never experience these kinds of things like cramping and bleeding and all of that stuff. But it's good to appreciate that we have to go through these things once a month and to just be sympathetic.
Okay. So we were in Costco. And this is years ago. And we just newbies to Costco. And so we're going up and down each aisle.
Yeah.
And we passed the feminine hygiene stuff. And I said half a sentence. I said, I'm looking at that and I go, honey, how come we haven't bought this? And as I'm saying this, my wife turns around. I see my son in the cart and a huge belly. She had been pregnant, nursing, and pregnant for the last 2.5 years. Why haven't we bought the Costco size? Because we bought one of those right before she got pregnant. So we hadn't bought any in a long time because she didn't need any.
Yeah. Funny story, but it was one of the first things that I asked my husband to do while we were dating. It was like, I'm out of tampons. Can you go grab me a pack? And he was like putting it in his phone. Which brand and
which size
and yeah, like color, like all of that. And I was like, okay, I'll keep you around. And look at us. We're married now. So it's a test.
It's a test.
Well, Dr. Heid, thank you. I'm sorry, Dr. Jim, thank you so much for this wonderful conversation. I appreciate you so much for deep diving into all these things just because you don't have a uterus does not mean you pass the buck to the ones that do have uteruses to deal with. So thank you so much. And thank you for sharing about your family with us. I think that was really cool that you were tracking your daughter and your wife's cycle. I think that's genius, actually.
Okay, but my wife didn't keep track.
Oh.
So
you had to do it.
The funniest thing is she saw my partner where I was in practice several years ago here, and she shows up for her annual exam. And the doc I share an office with, his medical assistant comes up, Dr. Heid, yes. When was your wife's last period? She doesn't know, and she says you track. Like, seriously, let me get my phone out.
Yeah.
Oh my.
That's hilarious.
Like, I don't need to track.
Yeah.
Jim does.
Jim does it.
There you go.
Okay. Either find yourself a spouse that is into this kind of stuff or marry a doctor. There you go. There you go. That's our last advice to our listeners.
There you go.
Thank you so much for joining us today. I hope our listeners enjoy this lively conversation. And Dr. Jim, we'll have you back to talk about other female-related things from a male perspective. Yeah.
That'd be great.
All right. Thank you, listeners. Till next time. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.